Good morning.
James Green.
Mr. Green.
Here for a CT scan.
Okay, Mr. Green. Yep, you're booked in. Please take a seat.
Your first visit to the radiotherapy department is for a CT scan. We ask you to use an enema and to drink 500 ml of water. This will all be explained at your pre-assessment appointment. After 30 minutes, you are ready for your scan. The radiographers will get you to lie on the CT couch with your head, knees and ankles supported. They mark 3 areas on your pelvis, which they will later tattoo. This will help us set you up accurately at each visit. Before we scan, we will do some measurements to confirm that you are hydrated and your enema has been effective. If these measurements are within our tolerances, we can go ahead with the scan. The scan only takes a couple of minutes, then the radiographers will come back into the room to do the tattoos. These are permanent marks and we ask you to sign permission for us to do this. We use these marks to line you up with the lasers we have in each room and are the starting point of setting you up ready for treatment. The consultant will use the information from your CT scan to outline the areas they want to receive high dose and the areas they want the dose to be as low as achievable. We do this on each slice of your CT images. In this 3D model, you can see the rectum in brown, bladder in yellow and the prostate highlighted in blue. This information is then sent to the physics department for the dosimetrist to plan. The region they want to give a high dose is marked here in red. Regions to avoid, like the bladder and the rectum, are also highlighted. They will work out how best to achieve a high dose to the prostate whilst keeping the dose as low as achievable to these neighbouring structures. On your first visit, you will be collected from the main reception by a member of the team. They will explain what will happen and give you an opportunity to ask questions. We ask you not to check into reception until your enema has worked, and please do not start drinking until you are called round by the radiographers. Once you have been called round and have finished your drinking, please make a note of the time you finished on a piece of paper and put it in the box in the little waiting room. Your treatment plan is designed specially for you. Please only follow the instructions given to you by the radiographers. We ask you to bring a dressing gown to change into as we are very busy. In the treatment room, the radiographers will get you to lie down in the same position you were in at CT. The bed will rise up quite high. You will hear them talking to each other as they do their checks. Please try to lie still and breathe normally. The machine moves around you, but it does not touch you at any time and you will not feel or see anything. The radiographers leave the room but are watching you the whole time on CCTV. If you need them, just raise a hand. The imaging arms will come out from the machine and the radiographers will review your images. You may feel the bed moving. This is because they are making small adjustments. When we are happy you are in the right place, they will switch the machine on and it will begin to move around you. Please remember you are quite high and don't try to sit up until the radiographers tell you it is safe to do so. During your treatment, you will be seen regularly by the review team who will give advice on skincare and side effects. Please remember that to keep your side effects to a minimum, you will need to keep hydrated, increase your fluid intake by 2 litres a day, cut out alcohol, eat regularly and exercise. A brisk walk every day is a good starting point. I hope this film has been useful. If you have any questions, please call us on 01743 261179. This is an answer machine, but somebody will get back to you. Thank you for watching.